Help us introduce the guest that's joined you here on the broadcast and give our audience more insight. What's going on?
See, just like you guys are a tag team, Dr. Robert Parisian, he's an orthopedic surgeon out of New York, and he's going to tell us about this very innovative treatment that they're now using to repair cartilage damage in the knee. So, Dr. Parisian, why don't you help people to understand some of the new technology out there? Because there's a lot of weekend warriors like myself. We want to save our knees. We still want to golf. We still want to play basketball. So tell us how we can get that done.
Well, hey, great to join you guys. I really appreciate being here. And anytime I can, talk football and talk cartilage in a night, it's a good night. As you know, there's a lot of knee pain out there, and we see, millions of patients a year, in the United States that come in with knee pain. Many have cartilage defects. Real quick, what's cartilage? Cartilage is this cushioning inside the knee that provides cushion and also a nice sort of ice, smooth gliding surface in the knee. And sometimes you can have this defect, which is like a pothole in the road is the way I like to describe it. So the rest of the road's fine, and you have an area that's just a pothole. That's a problem. It can cause swelling, pain, and decreased function, maybe lead to arthritis. So what do we have now moving forward, and that are really big technological advances is that we can do cartilage transplantation by taking your own cartilage cells, growing them in a lab, putting them on a membrane, perfectly size matching that and fitting that defect perfectly and transplanting your own cartilage cells into that defect. And this is called MACI. Matrix-induced autologous chondrocyte implantation is the big fancy word for it, but it's MACI, and this has really revolutionized cartilage transplant.
Robert, what's the timeline for something like that? If you were to take cartilage from different parts of the body and you mentioned grow it in a lab, what's the time frame you're looking at for somebody, or is it a case-by-case basis?
No, it's a great question. So the initial procedure, we go in and we do an arthroscopic procedure. What does that mean? Surgery with a camera. So a little incision like the size of my nail on my small finger, my pinky. I go with the camera, little small arthroscopic instruments. Size the lesion, measure it, take a piece of cartilage, send it to the company, Vericel, that can then grow it in the lab. About 6 weeks later, we can come back and we can implant that cartilage into the knee. Now, the company's going to hold the cartilage cells for 5 years. So, it doesn't have to be done immediately. So we have some patients that choose to do it immediately. We have some that choose to do it later, but it's a great option. The next procedure we go in, we make smaller incisions to transplant or implant that cartilage. Again, fill that pothole, replace that cartilage in your body. Now, recently, we've developed arthroscopic instrumentation that has been FDA approved in 2024 that allows us to really go in and, again, maybe the thumbnail on my finger, small incisions to use a little cannula and then just transplant that cartilage patch into the knee. So really making minimally invasive procedure here. So it's great for patient outcomes.
Where can we find more information on all this?
MACI.com is where you can look this up. The company, again, is called Vericel, that has really been helping us and assisting us surgeons that specialize in sports medicine, injuries of the knee, and cartilage defects. And you get a lot more information there. But like I said, the MACI arthroscopic, minimally invasive, just camera surgery is really revolutionizing cartilage transplant. It's an exciting time.
Thank you, doctor, for the time. From somebody who is in his late 30s with bad knees, I will keep you on file. Be sure to check everybody out. It's MACI, MACI.com here on PHNX Cardinals.